Welcome back. Today marks the beginning of National Drug Facts Weeks, and it is a health observance week that's targeted towards teens to help shatter myths about drugs or drug abuse. Joining us this morning from Gundersen Lutheran to discuss some ways to get the conversation started is Jacquelyn Hammen from the Behavioral Health Department. So thanks so much for getting up with us.
My pleasure.
And so first of all, oftentimes for teens, they are discussing drug abuse and drug facts at school, but what should parents be doing at home?
Well, I think that talking about drug use and providing information is a great place to start, but it can't stop there. So it's most important for parents to continue to have these kinds of conversations, particularly about expectations for their teens, their behavior, peer substance use.
And with that, what are some of the myths that this week is focusing on kind of curbing or getting rid of?
Well, I think one of the most critical myths is the safety inherent in prescription substance use. There's a lot of perceived safety implied in receiving something from a doctor or a pharmacy, and this is a big issue among teen use as it is.
So what are some of the things that you recommend that parents be telling their children?
I think it's important to talk about the risks, to talk about the dangers of using a substance that's not prescribed to you. But perhaps the most important thing that parents can do is model the kind of behavior that they hope to see in their teenagers.
And what are some of the risks?
The risks involved in using substances in general range depending on the substance being used. See, teenagers are in a critical window of brain development, and substances really interfere with the neural connections being formed between the more emotional, impulsive parts of the brain and the logical, decision-making parts of the brain.
Okay. And then also I think it's interesting, too, that a lot of people, when they hear about drug abuse, the first thing that they're thinking about is the illegal drugs. But really, what is the concern with prescription drug abuse as well? Yes, there's a huge risk among teenagers with prescription substances. And although they continue to use alcohol and marijuana in very high rates, prescription medications are becoming more and more common, and particularly a problem in our community. And then along those lines, is there anything else that, should they seek, when a parent has advice or has a question, who should they reach out to if they want to find out more about what to tell their children?
I think that schools can be a great resource for parents. They're already connected with the teenagers. They're already familiar with their particular teens. So I think that's a great place to start. But also any of the local agencies here in La Crosse provide a number of resources. The website's a great place to start as well.
Well, thank you so much for your time this morning. We appreciate it.
Thank you. Yeah, my pleasure. Thank you.